Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about immunosuppressant medications for peripheral neuropathy. Now, the idea is not all types of peripheral neuropathy are autoimmune or cause autoimmune type reactions. And in a true autoimmune type peripheral neuropathy, you're going to actually get different types of responses and different type of attacks. It may attack the nerve cell itself, the neuron. It may attack the myelin sheath. It may attack some of the antibodies, some of the proteins and enzymes that are being used as the antibodies are being attacked. So the idea is there's really 4 different types of autoimmune peripheral neuropathy that we see on a more regular type basis. Number 1 is Guillain-Barré syndrome, which we've talked about in the past. CIDP, which is chronic inflammatory demyelinating polyneuropathy. MMN, which is multifocal motor neuropathy. And the anti-MAG neuropathy, which is anti-myelin-associated glycoprotein neuropathy. So the point is that with each of these, there is a distinct abnormality, a distinct autoimmune problem that is happening in these different types of diseases. And so what's happening is we're looking for a way to stop that autoimmune response. So as we go through the studies, as they've gone through the studies and they actually looked at a lot of the different options, they really came down to five different options. So number 1 is IV immunoglobulin, subcutaneous immunoglobulin, so injecting it right underneath the skin, oral prednisone, oral dexamethasone, or IV methylprednisolone. So, which each of these types, they've gone through and tested these. So IVIG, so the IV immunoglobulin has been found in studies to be effective in Guillain-Barré syndrome, has been found to be effective in CIDP, chronic inflammatory demyelinating polyneuropathy, has been found to be effective in MMN, multifocal motor neuropathy, but has not been effective in the anti-MAG neuropathy, or the anti-myelin-associated glycoprotein. So in the first 3, IVIG has been very, very effective. Now, then when you go to the subcutaneous immunoglobulin, or SCIG, it's never been tested in Guillain-Barré syndrome. There's no studies that show that it works, and it's never been tested in anti-MAG neuropathy. However, it has been effective in chronic inflammatory demyelinating polyneuropathy and multifocal motor neuropathy. So in those 2, where it has been tested, it has been shown to be effective. So if you're using the immunoglobulin, they seem to be effective on the Guillain-Barré syndrome, CIDP, and MMN, not as effective when it comes to the myelin sheath or the anti-MAG neuropathy. So let's go to the oral medications. Oral prednisolone. So the oral prednisolone is not effective in Guillain-Barré syndrome, is effective in the chronic inflammatory demyelinating polyneuropathy, is not affecting in the multifocal motor neuropathy, and is not effective in the anti-myelin-associated glycoprotein neuropathy. So oral prednisolone is only effective if you have CIDP. Oral dexamethasone. Now, because oral prednisolone is effective in CIDP, there is studies now that show that oral dexamethasone is also effective, but it's the only one that's been tested is CIDP. So if you have CIDP, you can consider using oral prednisolone or oral dexamethasone, and they have been shown to be effective. So the last one is IV methylprednisolone, and the idea is that some of these are effective and some of these are not effective in them. So it was never tested on the multifocal motor neuropathy and never tested in the anti-MAG neuropathy. And it's found to not be effective, again, so whether it's IV methylprednisolone or oral prednisolone, it is ineffective when it comes to Guillain-Barré syndrome, but is effective in CIDP. So When it comes to oral medications, truthfully, it looks like the only one that they seem to work on is CIDP. The Guillain-Barré syndrome they do not work on. MMN, the only one that was tested was not effective on that, and the other ones haven't been tested. And the anti-MAG neuropathy, the only one tested, was not effective. So if it comes down to you want to do an autoimmune type treatment, IVIG seems to be the most effective, and will work on any of the neuron-specific type neuropathies, although it is not effective in the myelin-associated, so the anti-myelin-associated glycoprotein. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 134, autoimmune or immune modulating treatments for peripheral neuropathy. They can be effective if they're used on the right disease process. So just because you have peripheral neuropathy doesn't mean you should be considering this type of treatment. It should only be considered if it fits the type of peripheral neuropathy that